Hey everyone, welcome to the Doc May Diet Podcast. I'm your host, Dr. Brian May. Every episode, I strive to break down and talk about the most relevant health topics and give you the basics so you have what you need to know and understand in order to live a healthy and happy life. So if you're listening, thank you. And thank you for trusting me to guide you along your journey of personal health and wellness. Also, if you're listening, feel free to share my message. Go ahead and like and subscribe on YouTube, Apple Podcasts, and Spotify. And also follow me on social media on Instagram and Facebook at Doc May Diet. Without further ado, let's get to today's episode. All right, everybody, welcome back. Doc May Diet Podcast, episode number 16. Tonight's podcast is the most important podcast I've done to date because tonight we're going to be talking about inflammation. Inflammation is something you've heard me talk about several times so far, and we're going to get into why it's so important. But before we get into that, I want to make sure people understand that not all inflammation is bad. Okay. So when I'm talking about inflammation, I'm talking about chronic inflammation. The acute inflammation is good. This is what occurs when we have a cut, we have an injury, we have damage to the tissue. Inflammation happens. It brings swelling, more blood flow, more blood cells. The immune system reacts to it. It takes care of it. It gets in, it gets out, does its job, and everything's hunky-dory. That's good. This is also what allows us to heal and recover from our workouts that allows the muscles to grow. So acute inflammation can be good. Again, when I'm talking about inflammation, I'm talking about chronic inflammation. That's when the normal inflammatory process of the body has basically gone haywire and it won't shut off per se. And when it won't shut off, the immune system looks for something to attack. And what it ends up attacking is your own body. So when I'm talking about chronic inflammation, 9 times out of 10, it's a bad thing. Okay, so now you may be wondering, how do we know if we're inflamed? Well, chances are if you have headaches, neck pain, back pain, fatigue, insomnia, anxiety, depression, any kind of joint pain, digestive issues, autoimmune disorders. Again, that's how I knew I was inflamed. I was diagnosed with rheumatoid arthritis, cancer, colitis, other types of disease processes, basically anything under the sun, stressed out, chances are you're inflamed. So how do we know we're inflamed clinically? Well, there are a few blood work tests we can pull to measure the inflammation in our blood. So the first test that we can use to measure inflammation is known as C-reactive protein, otherwise known as CRP. So when CRP is elevated, there's usually an inflammatory process going on because this protein is responsible for tamping down on that inflammation. Now, during acute bouts of inflammation, CRP levels can be as high as 40 grams per liter. But during normal everyday life, they really shouldn't be elevated at all. So any level of CRP 1 or above, 1 gram per liter or above, usually indicates some chronic inflammation. The next test we can use is known as interleukin 6, which is another blood marker I've mentioned in the past. It's actually secreted by the T cells of the immune system, which, if you remember from last week's sleep podcast, are responsible for sending those messages out, communicating between different immune system cells so we can actually mount a proper defense. So when interleukin 6 is high, usually means we have some inflammation going on as well. And then thirdly, the best test we can do is actually what's known as a tissue omega-3 content. So in our body, we basically have 2 types of omega-3s. There are more, but for the purpose of tonight's podcast, we're going to talk about 2. We have omega-3 fatty acids, which are anti-inflammatory, and then we have omega-6 fatty acids, which are pro-inflammatory. Now, we do want more anti-inflammatory capacity, but like I mentioned earlier, not all inflammation is bad. So we do want some pro-inflammatory. So we want a good balance between anti-inflammatory omega-3 and pro-inflammatory omega-6. But this tissue omega-3 content should be about 60% omega-3. Okay, so next topic is what makes us inflamed? How do we become inflamed? Well, unfortunately, In today's world, today's modern society, there are tons of things that make us inflamed. First and foremost, we have the big ones like smoking, obesity, alcohol abuse, drug abuse, chronic stress, and then obviously poor diet, a diet high in sugar, low in fiber, low in protein, high in processed foods, high in trans fat, also high in gluten, and guess what? High in omega-6, which once again is going to make us pro-inflammatory. Some other common causes include lack of sleep, lack of proper digestion, and lack of exercise. Now, there are some other factors underneath the surface that people don't really think of. This would be things like poor air quality, poor drinking water quality, also chronic exposure to mold. We're really set in an environment that is pro-inflammatory, and especially exposure to chemicals like glyphosate that's commonly found in the weed killing chemical concoction known as Roundup. So exposure to any of those things can really create a lot of inflammation, some heavy metal toxicity within our body that's going to put us in this inflamed state. All right, so now that we've discussed what inflammation is, what it means, the different types, how do we know if we're inflamed, and how we get inflamed, let's talk about 5 of the worst things that can happen when we are inflamed. So reason number 1 that inflammation is so drastically important and we need to control it is its impact on our brain health. So when inflammation is triggered in our brain, the microglial cells that live inside the brain can't perform their functions properly. Their job is to remove the waste, the debris, the dead neurons, prevent that plaque from forming in our brain. When there's inflammation, the microglial cells can't clean the brain up, essentially. The spaces between the neurons get disrupted and they can't fire properly. Things get foggy, things get congested, hence the term brain fog. And when this goes on long enough, this is when we develop conditions like depression, anxiety. When it gets really bad, it can also lead to dementia, Parkinson's, and Alzheimer's. Certain plaque formations have been linked to these neurodegenerative diseases. And inflammation is so important to brain health that at this point, inflammation is actually considered the primary cause of depression, especially in cases where antidepressants don't work. This is because these antidepressants don't treat the inflammation, they just mask the symptoms. So whether or not you have full-bore anxiety, depression, or something worse like Alzheimer's or dementia, it's always a good idea to take care of your brain health and reduce inflammation so you have better mood, better energy, better focus, better memory, and also, more importantly, prevent these neurodegenerative conditions from forming. Okay, reason number 2 why inflammation is so important is its impact on our heart health. So this is actually a huge topic. I could probably do a whole entire podcast based off of this topic alone, and I may in the future, but right now I'm going to try and distill it down into its bare essential elements. So everybody knows by now that there's a connection between high cholesterol and heart disease. We used to think that it was due to a high fat diet, but now we know it's actually due to a highly inflammatory diet, which is actually, typically speaking, a high carbohydrate diet, spiking that insulin, causing inflammation. Now, I want to make the distinction that not all carbs are bad. I'm talking about the average American who's eating too many carbs, not exercising. Okay, carbs are not bad if you're an athlete, strength training, muscle building, but most people aren't doing this type of activities. So this is what has led us to this point in this country. So a high carb diet will cause insulin to spike, and it'll cause insulin to store that sugar and those carbohydrates as fat in the form of triglycerides. The molecule responsible for transporting the triglycerides throughout the body is known as VLDL, very low density lipoprotein. It's essentially a form of cholesterol. And when it's done doing its job, this VLDL gets turned into LDL, which you may recognize. Your doctor may have told you that LDL cholesterol is bad and HDL is good. And that's true to a certain extent, but not all LDL is bad. There's 2 types of LDL. There's big molecule, high density LDL, and there's small, even lower density particle LDL. It's the small LDLs that are dangerous because they're small enough to pierce the artery walls. And when that happens, the blood that's coming through the arteries has oxygen in it. When it pierces the wall, comes into contact with the oxygen in the blood in the artery, it becomes oxidized because that LDL is a lipid. When it hits the oxygen, it becomes oxidized, and that creates inflammation. Notice this doesn't happen in veins because veins don't carry oxygenated blood. They carry deoxygenated blood. So note that this happens only in arteries. So the small LDL pierces the artery wall, becomes oxidized, creates inflammation. Now, the immune system recognizes this, and it sends what's known as macrophages to the site where the artery wall is pierced to try and contain it, try and shore it up, fix that damage. But when we keep eating this diet of high carbohydrate, we creating more small LDLs, more holes in the artery walls, more inflammation, more macrophages, and then these macrophages become overwhelmed and they create what's known as foam cells. And this is what leads to plaque formation. And this is what leads to heart disease. So in summary, more carbs, more VLDL, more small LDL, they pierce the artery walls, create the inflammation, the immune system becomes overwhelmed, and this is what leads to plaque formation and, like I said, heart disease. So what helps with this? HDL cholesterol. This is the good cholesterol. This is the high density, bigger cholesterol, comes in and wipes out the LDL. What boosts HDL? Exercise and diet. Okay, reason number 3 that inflammation is so important to our body is its impact on joint health. So as I mentioned, chronic inflammation is the normal inflammatory process gone haywire. And usually what bears the brunt of this inflammation is our joints, the ends of the joint surfaces, the space between the bones where that synovium is, the synovial fluid. When that inflammation occurs in there for too long, it starts to erode the synovial fluid and the synovium, and it causes the joints to get achy, stiff, no longer moving the way they should. That's why a lot of people think that there's something wrong with their joints. They think there's a tear or a break or some kind of major disease in there. And the fact is, that's not the case. I have a lot of patients like this who believe that, but really it's just their diets that's creating the inflammation. So that's actually why I created my 9-week online nutrition course to help people combat this inflammation. So I'll talk more about that course later on, but it's quite simple, guys. You remove the inflammation and your joints will feel better. And guess what? You'll lose weight as a result as well. Reason number 4, inflammation is so important for our bodies, is its impact on our gut. So as I mentioned in the podcast earlier, our gut microbiome has a huge impact on the rest of our health. If our gut is out of alignment, so too with the rest of our lives and especially our health. So when we have this inflammation, we can no longer absorb and digest what like we should. And this will cause what's known as dysbiosis, dysfunction of the gut. And this can manifest in several ways. It could be constipation, gas, bloating, upset stomach, diarrhea, indigestion. Also, it can get really bad and develop diseases like Crohn's disease, irritable bowel syndrome, colitis. So research has shown the best way to combat this and prevent this from happening is to have a diverse array, a diverse population of gut bacteria living within our microbiome. When the bad gut bacteria take over, whether it's due to poor diet, lack of sleep, lack of exercise, antibiotics, a need of a probiotic supplement, whatever the case may be, when these bad bacteria perish and pass away, they release what's known as endotoxins, aka lipopolysaccharides. And when they get released, it creates this inflammatory environment within our gut, and therefore the rest of our body becomes inflamed. What also contributes to this is overconsumption of wheat and gluten will also punch holes in the intestinal linings, which also creates that inflammatory environment. And then reason number 5 why inflammation is so important to our body is its impact on our ability to gain and lose weight. So when we're inflamed and we're constantly eating the sugars and eating the high carbohydrate diet, insulin's going to be spiked. Insulin keeps getting spiked. The pancreas is working overtime, and this will cause our body to store fat and fat around the abdomen, which is especially dangerous because fat around the abdomen has been correlated to increased risk of cancer and heart disease, as well as a number of other disorders and diseases. So this is why waist circumference is such an important health marker, because it helps predict our likelihood of developing these diseases. Not only that, but inflammation will trigger less response to the hormone known as leptin. Leptin is the hormone that lets us feel full and tells us we've eaten enough. When that hormone isn't responding, guess what? We're going to be ravenously hungry all the time. Inflammation will also disrupt the thyroid adrenal axis, and the thyroid hormones are primarily responsible for our metabolism. And lastly, the more inflammation we have, the more weight we're going to gain because we store toxins in our fat cells. So the more toxins we have, the more fat cells we create. That's why when you get inflamed, you gain weight. When you gain weight, you become more inflamed. It's that vicious cycle that needs to be broken. So this is why you could have a patient who's working out 6-7 days a week, but until you address the inflammation, guess what? They're not going to lose the weight. And even if they do, they're not going to keep it off. So, Dr. May, what are 5 quick things we can do to reduce inflammation? Well, number 1, like I mentioned earlier, limit consumption of excessive wheat and gluten. That's going to punch holes in the gut, create that leaky gut syndrome, which leads to the autoimmune disease. Number 2, exercise. But we need to exercise properly because over-exercise will actually create chronic inflammation. We do want some acute inflammation with exercise, but we do not want chronic. Number 3, take a good omega-3 or krill oil supplement to help shift that ratio of omega-6 to omega-3 more towards the omega-3. We want to favor the anti-inflammatory. Number 4, fasting has actually been proven to improve the markers we talked about, like CRP and interleukin-6. And then number 5, prioritize sleep. We got into that in detail on the last episode. In addition to that, I highly recommend checking out my 9-week online nutrition course designed to remove the inflammation, protect your joint health, create an anti-inflammatory body environment within your body that'll allow you to lose weight. So go to docmaydiet.teachable.com, use the code DMD20 at checkout to save 20% on the course. Once again, that's docmaydiet.teachable.com. Use the code DMD20 to save 20%. This course will teach you everything you need to know to remove the inflammation, feel better, lose the weight, and keep it off. Okay, guys, thank you so much for listening. Really important podcast. Hope you got something out of it. Go ahead, share this episode on Apple Podcasts, YouTube, Spotify. Follow me on Instagram and Facebook at DocMayDiet, and I'll see you guys next week.